Hello everybody, Namaste. I'm Dr. Mandeep Malhotra. I'm the Director for Oncology at CK Birla Hospital in New Delhi. So 31st May was World No Tobacco Day, and everybody has tried to create a lot of awareness around tobacco abuse and it's the problem it creates when we are doing a tobacco abuse. So increased tobacco abuse in form of smoking, in form of hookah or tobacco chewing, from pan, bidi, zarda to gutka. So it creates one of the most dreaded diseases like cancers, specifically oral cancers, that is mouth cancers, throat cancers for voice box, cancer of lung, cancer of food pipe, and even things like they also increase the tendency for other cancers like breast cancer, stomach cancer, ovarian cancers, even cervical cancers. Apart from cancers, diseases like heart disease, stroke is also increased, and respiratory infections, chronic obstructive pulmonary disease, and sometimes there is a dreaded complication of Burgess disease, that is the blood supply to hands, to feet are decreased, and sometimes even it leads to amputation. So apart from the medical complications for tobacco abuse is causing, there is a lot of other things which it causes. First of all, second-hand smoke. So what is second-hand smoke is that if my family member, my friend, my child, my wife, they are non-smokers, but if I start smoking, so obviously some amount of effect of second-hand smoke, that is what I exhale out, is obviously is inhaled by them. So if my chance of getting cancer is around 30%, they would also have a chance of getting disease like cancer, heart disease, at least 5%, which is much higher than other normal population which is not exposed to tobacco abuse. Another important fact is that it creates a lot of economic pressures, because there's some amount of the family income which is being put into buying tobacco and obviously abusing it. Then there's a social impact on the children. They feel that there's something which is good, and they also tend to follow the same things when they grow into their adolescence and even adulthood. So we do see a lot of children, like if the father is smoker, the child would also tend to take up this habit, and they tend to take up this habit at much earlier age. Even at adolescent tender ages, they get into these kind of habits. Another important thing is that the smoker itself or the tobacco abuser, he gets into a lot of health issues. So when he gets into a lot of health issues, so there's a lot of family income which goes into treating these health issues. Another thing is that majority of people, when they are into tobacco abuse, they are not able to cater or look into the factors of some important issues around family, around their personal life, around their office life, that is professional life, and that also starts affecting them. So the thing is that tobacco abuse not only affects the health, it also affects the financial well-being of the person, it also affects the social well-being of the person. It just not affects the person itself, it also affects the friends, family members, and even their children.